It's time to start this webinar. Good morning, everyone. Good afternoon. Thank you very much and warm welcome to the second vaccine hesitancy webinar organized by vaccine advisory firm from Crown Agents in collaboration with CARAC and the Asian Development Bank. Before we start, let me give you a few tips on housekeeping. We have consecutive interpretation, so you please choose your language of the presentation. You can find it at the view options at the top of your screen. Choose the language, mute your microphone when you are not speaking, though I have to say most of you will be muted by the host of this meeting. For presenters, please kindly stick to the time allocation for presentations, which is like 10 minutes. And mind the chat box for timekeeping reminders, or I'm going to remind you, apologize for that, but I think there are no other way to do it. For speakers, please speak clearly and try to avoid talking too fast to allow for simultaneous interpretation. Use the raise hand button if you have any comments, questions, and wait for the moderator to call on you before speaking. I hope that you have already write your name, country, and the language you prefer when you were registering for this Zoom meeting. Objectives of the meeting is to share with you the results of the hesitancy surveys among the health workers, identification of the key problems and successful practices in the countries of the region. And I think this is very important part of presentations, and we are eager to see the countries and what they have to say. Finally, and I think equally important, is the discussions about support plans for changing social behavior or other communication activities that we can do together as a vaccination consulting firm, VAF, and colleagues from the country level. The agenda for the meeting will start with this welcome session by the colleagues from the Asian Development Bank, welcome remarks. After that, we're going to have a photo session as we had at the webinar one. Then we move into country presentations, and we'll start by alphabetical orders. We'll start with the Republic of Armenia, so I kindly ask presenters from Armenia to get prepared. Then we have presentations of a hesitancy survey by vaccine advisory firm, and we'll have a session on questions and answers and discussions that will be moderated by our colleague from CARAC project, and of course closing of the session. Before further ado, let me ask Kirti Ramesh, social sector specialist for Central and West Asia Department at the Asian Development Bank, to address the audience. Kirti, are you there? Okay.
I'm not so sure. Probably we can ask Sarah to tell us if Kirti.
Hi, Larissa. Yeah, it's joining. We just messaged, reminded.
Okay. I'm asking technical colleagues if we can do the photo session maybe before Kirti join us.
Yeah, it's probably a good idea, just not to waste time for the presentation. We shall ask, please, our dear participants, switch on your cameras and keep it for some time to give the organizers opportunity to make the photo, please.
Larissa, can you do it in Russian as well? Or they
Да,
have
да, но у нас есть перевод идет сейчас. Мы просим, пока мы ждем коллег из АБР, может быть, мы сделаем действительно сейчас фотографию, мы просим вас включить ваши камеры и какое-то время подержать их включенными, чтобы наша группа технической поддержки сделала нам фотографию.
Thank you. Switch on your cameras, colleagues. Arvik, we want to see you at the photo. A few more seconds. We're waiting for a signal from the technical group, please.
Большое спасибо, коллеги. Прислали сообщение, что фотографии сделали. Да, и я вижу, что Брайан на связи. Я не знаю, Кирси уже присоединилась или нет. Brian, I can see that you have joined the webinar already. So shall we wait for Kирsi to welcome the webinar, or probably you can do that? So we will go straight to the presentations.
Hi, Larissa. Curtis just having some technical problems with her laptop. She's currently restarting her computer.
Yes, I see. So,
so maybe I will just take over on this part of welcoming the participants for the second vaccine hesitancy webinar, the second of 2 webinar series. So I don't have much prepared except to welcome all the participants for your interest and taking time for joining this second webinar series. I think there will be a lot of interesting discussions today based on the vaccine survey results. I'm very interested to learn about that, as well as what the countries have prepared in terms of the presentations on the few identified areas and questions based on, identified challenges to vaccine hesitancy, as well as identify solutions to the vaccine hesitancy, and what has worked best in your countries in terms of addressing vaccine hesitancy with a focus on social and behavior change communication. I see my colleague Kirti has joined, so maybe I just hand over quickly to her for the opening remarks. Thanks.
Thank you, Brian.
Thank you very much, and apologies for facing some technical issues. A very warm welcome to all the participants to the second vaccine hesitancy seminar. My name is Kirti Ramesh, and I'm co-chairing the session with Mr. Brian Chin, who was just speaking, who's a senior health specialist at the Central and West Asia Department. We're very delighted to have you at the second session again. Today is an exciting day, and we will be hearing more from countries. During the last webinar, our expert from the Vaccine Advisory Firm in Virginia have given some insights and overviews on key topics on vaccine hesitancy. So today is an opportunity to delve further into this. Yeah, I actually would like to already stop here and hand back over to the moderators. to start the first session. So very warm welcome again, and I hope you do enjoy this session, and it will bring you a lot of insights on best practices from other countries in the region as well. Thank you.
Thank you, Kirti. Thank you, Brian, and thanks to two of you and the ADB for all your support to the region. We are looking forward to expand this collaboration. And now we're moving to country presentations, and we'll start with the Armenia. I hope the Armenia presenter is ready, so please kindly go ahead.
Thank you very much.
Thank you.
Okay, great. Can everyone see my slides?
Yes.
Wonderful.
Yes.
Wonderful. Thank you very much for having me today. I do think that these conversations, the first conversation that we had at the first webinar was quite useful, and I hope that we can continue to have very fruitful conversations during this webinar and the third one as well. My name is Aras Chiloyan. I am the advisor to the minister. And so before we kind of dive into some of the questions, I kind of wanted to give an overview of what the situation in Armenia is at this point in time. So we have a wide portfolio of vaccines, as you can see on the left-hand side. Our first dose uptake for the entire population is about 38%. Fully vaccinated accounts for approximately 33% of the population, and we have a small number of individuals that have received booster doses, right below 35,000. And on the graph on the bottom, you could see that we really had a big rise in vaccinations in October, and I'll kind of get into some of the reasons and successes that we saw with that. But since then, we have seen a steady decline, and we have seen a decrease in first dose uptakes. And so we really hope that we could listen to what other countries have to say and be able to pull some information from there so that we may be able to use some of the techniques that have been successful in other countries. In terms of procurement, Armenia has been able to procure vaccines successfully. This is the breakdown of where we have received our vaccines. The highest donations are what account for the highest number of vaccines in the country. We currently have had over 4.2 million doses, and we've used about 2.4, 2.5 million doses at this point in time. And something that I think may not only be useful to Armenia, but something that other countries may have potentially used is the precaution adoption process model. And so we've done a lot of surveys, and we've really tried to pinpoint where it is that we need to work on. And where I've kind of circled is what Armenia still is struggling with. And those are kind of the main three stages areas that we are really focusing on now. There's a lot of, everyone is aware of the issue. So stage one is a bit irrelevant at this point in time, since it's been 2 years since COVID, the first COVID case. But if we look at stage 2, 3, and 4, I think there's a very interesting technique that needs to take place for each stage in order for us to be able to address the hesitancy at each of these stages. And so that's what we've been trying to develop over the last couple months. So in Armenia, some of the factors influencing hesitancy is the lack of public confidence in the new vaccines. I think we did touch upon this during the last webinar. We hear a lot of information, a lot of people concerned about that there hasn't been enough testing. We don't know the long-term consequences of these vaccines, etc. And, you know, I think we talked about this in depth during our last webinar as well. Another big thing is misinformation, myths, the negative news that's been circulating about COVID-19, as well as the vaccine itself. And then the safety and effectiveness of the vaccine is a really big one that we've seen. And then personal responsibility and risk perception, I think, is another big one for Armenia. We had a CAP survey that was completed this past summer. About over 3,000 people participated, were surveyed. And something that was incredibly interesting is that 70% considered themselves susceptible to contracting COVID-19, but the same percentage of people so that they would not be seriously ill. So they thought they would get sick, but they thought that they would, you know, take it in they wouldn't have the severe version, they would have a very mild version. And so that's why they said that there may not necessarily be a need for themselves to get vaccinated. And then another really big one is fertility and health concerns. We've been hearing this from both men and women that they're worried that it may affect their ability to have children. And we actually just had a CDC survey completed in the country last week rather, and we had the results presented this past week. And that seems to be a continuing trend as the population that was surveyed continued to say that fertility and health was a concern. Some of the effective social behavior changes, change communication that we've been able to implement is the enforcement of policies for employers, employees, and public spaces. And that's kind of, if we think back to the graph from the first slide, we see that there was a very sharp increase in October. And so we had the enforcement of either having to show a test or a vaccination certificate to enter public spaces and places of employment. And that really caused an increase to our numbers. And apologies, public spaces was actually closer to January. Employers was in October. And so that really caused a big spike in our numbers in terms of vaccination numbers, which was great. Extensive risk communication material with clear messaging and information. We have approximately 12 national and international stakeholders that work together. We meet on a bi-weekly basis, and we come up with content, we share ideas, feedback, and we just make sure that we have the most well-prepared communication materials. And this has really helped to reduce overlapping and has helped us to be a little bit more organized in terms of what we're able to put out there. And so we've been working very hard to develop a communication strategy for the upcoming year. And that one is going to be used to continue to drive these conversations with those stakeholders. And the continuous communication activities to improve healthcare workers' knowledge and their communication methods with the patients that are going in to receive vaccinations. This is something that we're continuously working on, more so the second component with communication methods to how they can get patients to get vaccinated and convince them. Because if we go to the next slide, we can see that vaccination among healthcare workers in Armenia is the highest among all risk groups, with 96% of healthcare workers having received both doses, which is an incredibly high number, but we're having a difficult time translating that for them to have those very, not difficult, but have those very sensitive conversations with patients who may be on the fence about getting vaccinated. Another big success for Armenia has been the streamlining process of vaccination. So in the beginning, it was quite difficult, lots of paperwork. And since then, we've been able to develop some methods to kind of reduce that, have everything be geared more towards an online database. And so that's really helped in terms of getting people in and out much more quickly. We've had mobile clinics, which we had never had before in Armenia. And so that's been a bit of a success as well, and has helped to allow those that want to get a vaccine in a quicker way to go there. And then we also have a new website that was launched, and this includes everything COVID related. We did have our National Center of Disease Control did have a website, but what we did is we kind of made it bigger and better, and we were able to add many more components, have interactive maps, have interactive data, so that maybe the public will be able to use this information. They can, play around with the numbers, look at different averages across different time periods. And I do think that could potentially also assist with the feeling of transparency and being able to provide all that information to the public in a much more aesthetically pleasing way and an easier way to read and understand. And that is all that I have on my end. So thank you very much.
Oh, thank you very, very much. This is fantastic presentation, obviously a great work, and you remind us all how difficult it is to make decisions that for us looks very simple, but it's underlying cause of a hesitancy and the critical to address. Thank you once again. Let us move to the Azerbaijan Republic. I hope you are ready. Azerbaijan, please.
Yes, hello everyone. Good morning and good afternoon, depending where you are.
Thank you. Good morning to you.
Thank you. So let me briefly also provide you with the information about the vaccine hesitancy and the factors that affect the vaccine hesitancy in Azerbaijan, and also looking forward for discussions and exchange of best practices in the field further. Briefly would like to tell you about Azerbaijan. So just to form the background information, Azerbaijan is upper middle income country, and whoever have difficulties with English, I try to put the Russian translation as well under each English information. And the population is of 10 million. And by March 30, 2022, we have had about 791,000 COVID-19 cases and 9,687 deaths that are attributable to COVID-19. And at this moment, in the last week or several weeks even, we have less than 100 cases of COVID a day. And of course, the DNA testing confirms that it's Omicron variant that we're having in Azerbaijan. In terms of the vaccination in general, as you can see from this slide, everyone above 18 plus in terms of the adults, and children 12, 15 and above are eligible for vaccination. But the vaccination among children is very low, and it's in Azerbaijan. In terms of the vaccines that are used currently in the country, it's very different from what we have had in 21 and at the beginning of the end of the 21. Then we had Sinovac, Coronavac, Pfizer, Sputnik, and AstraZeneca vaccines available for vaccines in the country. But at this moment, the primary vaccines that are used are Sinovac, Coronavac, and Pfizer. And both of these vaccines are used for the first-time vaccination, as well as mostly for the booster doses. In terms of the doses of the vaccines delivered, you can see that we have had by March 30, over 5 million receiving 1 dose, over 4 million receiving 2 doses, and over 3 million receiving 3 or more doses with the vaccines. An interesting fact from what we have here is a lot of people receiving 4 doses, which means 2 Coronavacs and 2 Pfizers. So that is also common in the country. And the current daily uptake of the vaccines is about 20,000 a day. But this number changes from day to day and week to week. But this is just a rough representation. In terms of the vaccine hesitancy, I would like to draw your attention to this stages of change model that we have been using to inform our policies, as well as to develop strategies and actions. And this, of course, changed through 21 and 22. I think we are currently, as many other countries, in the phase of action and maintenance, basically, where the action is still and preparation are still ongoing for very few people. But mainly we're trying to put a lot of efforts to sustain the vaccination and to put the emphasis on the ones that require booster doses to enhance their health. In terms of the factors that are influenced in 21, but still continue to influence the population decision on the vaccine uptake, they're not much different from many other countries. But the 2 things that I would like to mention that have come up in all our surveys and studies that we have been doing with the support from WHO and other Ministry of Health agencies in the country for almost 2 years. Almost every 4 months, we have been doing studies among the general public, as well as over 1 year, we have been implementing, with the support of the WHO, the study on vaccine effectiveness among healthcare workers. So we try to learn the situation on, in terms of the vaccine hesitancy and vaccine uptake among general public, but also the specific group, which is healthcare workers. So 2 things that I would like to stress out here is the misinformation has been accounted as a key driver for vaccine hesitancy, and it's played a huge role in reducing general public's trust and confidence in the immunization process. And I'm putting here emphasis on immunization process, not just on immunization or vaccination against SARS-CoV-2 virus, because that also put a lot of significant strain on the public thinking and trust on other vaccines, particularly for childhood vaccines and other repeat vaccines for adults. The second thing that have been that we have been hearing a lot was the hesitancy related to speed of vaccine development and perception of the less stringent control system over quality and safety. So the public has been outcrying that the infection control and overall public safety that the government and country's leadership has been trying to put in many countries of the world outweighed the individual safety. And because the unknown, it was unknown territory, the public trust on these vaccines have been significantly undermined. In terms of the healthcare workers, that was a little different story. So in the study that we have been implementing for almost more than a year, what we have found, that's very interesting factors that also helped us and will help us to form the policies and actions in the months and years to come, not only related to COVID, but on other infection control measures and vaccinations for other infections. So it's interesting to say that among the healthcare workers, and I mean the healthcare workers including technical staff, gardeners in the hospitals, I don't know, nurses, doctors, and everyone. So with very much advanced knowledge of medicine and health issues, but also the ones that have very little understanding of the medicine and health. So there's just technical workers. So they kind of represent to some degree the general population, to some degree, of course, with some limitations. So it's interesting that we noted, and we have noted a lot of factors that influence vaccine uptake, but the couple things that I would like to mention here. The one is those with at least one comorbidity were 27% less likely to be vaccinated. And compared to those in excellent health, those in very good, or fair, poor health were less likely to be vaccinated. And those who believe the vaccine is unsafe, of course, were less likely to be vaccinated. And the ones that believe that the vaccine is ineffective also were less likely to be vaccinated. And this is one of the important things about another factor of vaccine hesitancy, that a lot of people were getting infected with COVID, whether symptomatic or less symptomatic, and their trust in the vaccine effectiveness were getting lower and lower because they were getting infected right immediately, very short period after the vaccination. And with the lack of information and very trusted information.
More minutes, please.
Sure. That was also affecting their likelihood of being vaccinated. And 2 more things, with the increase of the age, the vaccination uptake has been increasing. And younger ages were having more hesitancy to receive the vaccine. And of course, the people that received flu vaccine were more likely to get vaccinated against COVID. So at this moment, we are still putting a lot of emphasis on maintenance, and the maintenance includes the health communication measures still continue using vaccine passports to improve the vaccine uptake, including the booster doses, and of course the employees engagement programs within the big government and private companies. And the evidence is being gathered to form the policies and guidelines. Still these days include behavioral change studies and vaccine effectiveness studies that we continue to this date. And here is just a couple slides from the vaccine registration website that the government put together for everyone to get registered and go and receive the vaccine. And of course, there are a number of information websites that provide the public with the trusted government-backed information on COVID, on vaccines, and their effectiveness, as well as on side effects. Thank you very much.
Thank you, Nabil. This was a fantastic presentation. Thank you for pointing that the COVID-19 vaccination will have impact on all vaccines, and that it's important to address all issues as soon as possible. And thank you very much for reminding us that we need to wear a mask. And I think this is also very important. Let us move to Georgia, please.
Thank you. I'll just share the presentation. Just a second. I apologize for the Georgian slide, but it's every day we have this updated statistics about the vaccine coverage in the country of Georgia. We started the COVID vaccination was initiated in 15th of March. It was at that point available two vaccines, AstraZeneca and for the Pfizer vaccine. It was the not enough doses, so we initiated the vaccination in the particular target high-risk group, including the healthcare workers and of course the people with chronic conditions and over the 60 years old. When there was available more vaccines, so the age restriction was of course removed, and it was available for all adults over the 18 years old. Currently, the vaccination coverage with at least one dose is 47.3%, and with the two doses, 43.7%. Though the booster doses remain one of the lowest, still remain the low. After we faced after the Omicron spread of the Omicron variant in the country, detected in January and February, having after this wave, and more population getting the infection, there was of course decreased the number of people going to the vaccination center, and it also impacted the overall, of course, vaccination uptake for those who are getting the booster doses as well. This little bit of outdated data, but it also indicates how the vaccination rates are different by the time we introduce different interventions to support vaccination activities, introducing, for example, the incentives for the older population. Started with incentives of about it would be, I don't know exactly how much in the USDs, but it's 200 lari for the first vaccination dose for the people elderly, for people started with among the people aged over 60, and then to over the 50 years old. Among adults, there's more coverage relatively among the people with the 60 and upper age, and very low among the lower age population. Particularly, we have recently conducted a very important study among the youth, and we also see many challenges in, of course, uptake of the vaccination in the lower, younger youth age at this point as well. There's also important, we have the specific target group, including the high-risk group, not only the elderly, but for example, the healthcare workers. It was very low in in 2021, but with the initiation of a number of interventions, we managed to increase the vaccination rate among healthcare workers. Though here we also wanted to indicate that the success was more evident among physicians than among the lower medical personnel, including the nurses and sanitary personnel at the clinics. So they still remain one of the resistant healthcare providers group in the country. There is a number of studies conducted among different population groups. As I mentioned, recently we had this presentation of the youth population, among healthcare workers, among general population, these different research waves conducted by the WHO group, or the research group with standard methodology. And what we see, one of the main barriers in the population remain the vaccine safety concerns, and it's both in population and among healthcare workers. In the previous meeting, I mentioned one of the important events that had a huge influence on the vaccination uptake in the country. This was the death case of the nurse at the hospital. When we had only 1,000 people vaccinated, and it's still having a huge influence on the population. There's still being one of the biggest, let's say, the challenge to communicate with even the healthcare workers. The second one of the important challenge I would indicate here is the management of expectations versus the pandemic fatigue. This is always one of the challenging part is always identified among the studies, that the balancing of the messages and increasing the risk perception in population, not to causing the panic and negative, let's say, overall impact on the mental health, but also creating this risk perception of a population, and also balancing the expectations of the after the vaccination. And it's been evident that after the spread of the Omicron, what we saw that population still struggled the understanding of the benefits, and there was a lot of among those who even the vaccinated had a lot of concerns, like why they get the Omicron, though they had the booster, even the booster doses, and seeing a lot of people even getting to the hospital despite getting vaccination. So that's been a lot of course, discussions, and now, of course, influencing the uptake currently of vaccination rate in the country. Unfortunately, the biggest stock of the Pfizer vaccine was recently, its expiration date ends in 31st of March, so like tomorrow. So, and we had to so those a lot of this number of the vaccination was wasted, let's say, and not we managed to use and reach the population to provide this vaccination. Infodemic and uncoordinated and conflicting messages was also an important challenge to lead the communication. Though since the beginning we had the communication campaign with all the influencers and speakers identified, still there was plenty of room left for the new appeared health experts and influential healthcare workers who used this opportunity to share their opinion or giving the different confusing messages to the population, increasing their, of course, concerns about the, again, vaccine safety and again, effectiveness. And still, currently, we struggle with one of the important challenges that's population already. There's a big message that the pandemic is over, and there is a lot of work currently continue to identify the new ways how to communicate with the public in creating the demand at this stage. The most important activities our colleagues from Armenia and Azerbaijan mentioned, increasing the access to information resources, and we had
two more minutes.
Yes. So increasing, so one of the important was increasing this, strengthening the healthcare workers' confidence, communication capacity, and involvement in the vaccine process. Targeted communication campaigns based on behavioral insight data, that was also important. Strengthening communication, coordination, and collaboration. That was one of the biggest challenge starting since the vaccine pandemic, because coordination of communication and risk communication particularly was a huge challenge to reaching the regional population in the region. Working directly with communities, so involvement of local stakeholders, and of course the regulatory mechanism, including vaccine certificates and incentives for vaccination. I don't have the huge big time to discuss the vaccine marathon campaign, but basically it's switching from the mass vaccination center to reaching and doing the outreach vaccination campaign and reaching elderly people at high risk and going in the region and reaching those who not only with the vaccine but also information to get them involved and get them important, let's say, life-saving support. And finally, there was also requested to provide, discuss what we'd expect or would be important to have a support. And so we consider that capacity building, not only the short-term but long-term solutions should be initiated in the country, because there's a knowledge gap and there's a huge challenge in medical education. I don't know in our neighbor countries, but it's one of the important problem being the barrier for persuading the healthcare workers to get involved in vaccination and promoting vaccines in the country. Policy strategies and mechanisms to enhance coordination, collaboration on communication with the general population. This is also important, and having these mechanisms is crucial when we have a short time, resources, and to reach and give important risk communication messages. And social listening platforms and behavioral insight data collection resources are also important. Because fighting with the disinformation is one of the important measure, and unfortunately the anti-vax campaigns and disinformation campaigns using these platforms very successfully, and we always are not time efficient to responding on them. And finally, initiatives to engage with wider group of stakeholders and science community is in discussions and jointly search for solutions. This is also important because we here see this split of the communities and turning it to more political discussion rather than scientific discussion, or and relatively less support for vaccination in the country for those important key stakeholders. Thank you very much. That was very quickly.
Thank you, Marina. Thank you very much. Thank you very much for identifying those areas of potential collaboration in the future, and we will respond to that definitely. Also, I think was very important that you reminded us how the promotion of vaccination is linked to other preventative measures, and this is something we need to have in mind. Let me try right now. I have a bit of a difficult task. It's to show you the presentation that was my colleague Shalkar was supposed to do, but unfortunately he is stuck somewhere with a flight back to Kazakhstan. So let me try to give you briefly a bit of information about the results of the vaccine hesitancy surveys. As you know, we have developed survey actually a month back with the aiming at analyzing situation with the health workers, something similar that the work of the colleagues in Azerbaijan. The survey was posted on Google, as well as we have done some face-to-face survey in number of countries. So far, we have something over 500 responses, and we're still getting responses, which is good, but also would like you to promote this survey that can be found on the links over there. We were trying to use the snowball sampling methodology, and it seems working, and it's warming up in a number of locations. So we had two stratification. Basically, one was the survey for healthcare managers, and then the survey for the primary healthcare workers. We have seen that the vast majority of the healthcare workers in our region is actually female, but nothing new, but important to acknowledge. Let's see some of the results among the healthcare manager surveys. Let me go quickly through this. As you pointed out, a majority of colleagues have been vaccinated at least with the 2 doses. Many of them have already received the booster dose. And this is, I think, very important for this seminar as well as for the work that we are doing. The vast majority of healthcare managers agree or strongly agree that the communication is important to reach country and regional immunization goals. They have a bit of also a different descriptions. Somebody have a microphone, can you please mute it? Thank you. We have a bit of a different opinion about whether the communication campaign is successful in the country of the respondents, with some of them that are undecided and very few that strongly disagree with that. The communication campaign needs to improvement in my country, and a vast majority, over 3/4, agree or strongly agree with that. We obviously facing situation in which situation is actually evolving in a country, and we need to be flexible and adapted to the situation. People are very comfortable with their own vaccine communication skills, which is good. They also believe that most of the colleagues are proficient in vaccine communication. Again, this is results of a survey among the health managers. What are how strongly you agree or with the factors that affects immunization goals in your country? Possible side effects of the vaccination. This is something that colleagues already identified. Confidence whether the COVID-19 vaccines will work or not. Also one of the important issue. People's belief whether the COVID-19 vaccine is needed or not. That's another of a major concern. Then the issues related to vaccines generally, with a strong opinion that people do not like vaccine generally. This is something that we really need to dig deeper to understand whether this is truth or not. People also wait and see if the vaccine is safe, and they defer the vaccination. Obviously, one of the factors that affect hesitancy in many populations. People think that other people need it more right now. I don't know how to comment on that, but certainly this is something that requires a bit of a more, let's say, a more thorough look into that issue. Religious beliefs, I guess, in couple of countries, we have very strong influence of some religious groups. Social media, obviously a challenge for a number of countries where health managers agree that this is a really a major issue to be addressed. Then the trust in government is seems to be better than in some other countries in the region. Trust in pharmaceutical companies, which is also linked to this issue of whether the vaccines were produced too fast, and the issues related to vaccine quality that some colleagues have already identified in their own countries. Access to vaccines is obviously very high and not an issue that cause a major hesitancy among the population. Again, the issue of whether vaccines are developed too fast or not. Then another set of questions was related to trust of the people in the countries in the sources of news and information around COVID. Obviously, the trust in health workers, clinics, and community organization is high. Local scientists and other health experts also are very high. Government authorities, trust in politicians not so high as in health professionals and the scientists, which I guess it's not bad. There is an issue with the journalists. Friends and family are becoming a very important source of trust, of course, in all communities. Religious leaders, international scientists. The other part of a survey was aimed at primary healthcare workers. So let me go quickly through this. Obviously, high number of them had virus infections, despite the fact that they were vaccinated in a very high percentage. Only around 1% of the 99% actually responded that they were vaccinated. Only 1% prefer not to say. You will see that we have a range of vaccines throughout the region, and obviously AstraZeneca is one of the most frequently used or preferred among the health workers. Again, on vaccination, do you plan to get vaccinated? Obviously, against COVID, this is related to booster dose and other doses. Obviously, 60% yes, 32% still hesitant, and only 10% responded as no. Yeah, this is around the administrative or other pressure that sometimes can be used as an incentive and motivation. Not only sometimes the pressure could be a positive, let's say so. The trust in efficacy and safety of the vaccines among primary healthcare workers is obviously high, which is very good, also because they can confidently convey the message to population around the vaccine safety. A majority of the people in the region think that COVID-19 vaccination should be mandatory. I think this is also something that we can discuss with the country colleagues. Again, obviously the fact that the population has an access to vaccination, that's really good, and this is what makes this region really stand out comparing to some other regions in the world. Obviously, the new strategies such as mobile teams or mass immunization points in the urban areas were effective. And then this is something which caused a little bit of concerns among us. It's the theories around the emergence of the coronavirus infection. Still, we see that many people believe that was artificially created, and many people, 1/3, has a difficult to answer. Obviously, this is also one of the issues that concerns health workers and probably needs to be addressed in a more systematic way. Okay, in a summary, as I'm saying, this is not the final results, and we'll have a final result soon, and we are planning to publish it and share with all of you. I think that obviously important for us and our today's work is that the respondents believe that the communication campaign is successful. But also they're all acknowledge and agree that the campaign needs improvement. And I think this is the reason why we are discussing today how to work together. Healthcare managers believe that the social media plays important role in immunization adherence. Obviously, this is not new, but I guess the pandemic vaccination help us to understand how the communication environment change around us, and that we need to adapt to those changes. Again, the issues that concerns health workers, such as this of the COVID being of artificial origin, is just one of the issue, but we will finalize a research in weeks to come and be able to give you a more precise and more detailed information. So I will stop here. I was not looking at my watch, but I hope I didn't exceed 10 minutes. Now we move to last 3 countries. This is Kazakhstan, Kyrgyz Republic, and then Republic of Tajikistan. So if I can call colleagues from Kazakhstan to take over.
Dragoslav, I'm not so sure that the colleagues from Kazakhstan managed to join us, because I don't see Mrs. Madina Rizbaeva in the list. So, and we don't see any response at the moment.
Then the
so
Kyrgyz,
Kyrgyz Republic, please.
Ms. Burul Asilbekova from Kyrgyz Republic, can you please take over? Are you there? I cannot hear you. Yes. we have colleagues from Kyrgyz Republic. Can you take over and go ahead with your presentation? Okay.
Yeah, I know that that Burul is.
Yeah, I see the name also. Oh, yes.
Бурул, вы говорите?
Yeah.
Давайте подождем минутку, потому что я знаю, что она подключается с телефона, может быть, какие-то технические.
Здравствуйте.
Мы вас слышим. Бурул, ваша презентация на экране. Если вы можете, начните презентацию и говорите нам, когда нужно переключать слайды.
Алло.
Вы пропадаете, Бурул, мы вас не слышим. Коллеги из Киргизстана, может быть, кто-то может помочь?
Могу говорить, Лариса? Скажите,
Говорите, говорите.
Бурлыджи, говорите, у вас проблемы?
Добрый день. Еще рада вас всех на данной встрече. В Кыргызстане сначала масса очень работы, очень много мероприятий проведено. Реализация проведения вакцинации против коронавирусной инфекции. И массовая вакцинация ровно будет выполняться сегодня. И на слайде мы сегодня показываем по городу Бишкек, потому что было дано на прошлом вебинаре, поэтому из всех регионов по городу Бишкек самый такой низкий охват сравнительно с другими регионами. У нас по городу Бишкек первой дозой 42,8%. Вторая вакцинация идет, вторая доза 35% всего лишь составляет. Но это у нас проблемы сегодня, поэтому у нас так, Ларис, следующий слайд, пожалуйста.
Да, переключили, пожалуйста, говорите.
Следующий слайд, пожалуйста, покажите.
Да, сейчас у нас слайд на экране по проведенным мероприятиям.
Да, проведенные мероприятия, которые значит, онлайн для работников, для организации здравоохранения, для образовательных учреждений, проведено обучающие тренинги среди медицинских работников, проведено несколько этих круглых столов, санитарные предписания были подготовлены, радио и телевыступления тоже очень много провели. Работа в данном направлении продолжается. Также у нас в целях для того, чтобы улучшить доступ к услугам иммунизации населения, вот именно где труднодоступных отдаленных территориях в организациях здравоохранения по городу Бишкек были организованы мобильные выездные бригады. И они сейчас у нас в данное время тоже работают, тоже работа в этом направлении проводится. Но несмотря на то, что у нас такие работы проводятся, имеются проблемы. Покажите следующий слайд, пожалуйста.
Да, следующий слайд по проведенным мероприятиям, которые начинаются в целях улучшения доступа.
Я это уже сказала, Ларис.
Да, хорошо, переключаем следующий слайд с фотографиями.
Бригаду, то, что, которая организована по городу Бишкек, мы... Да, это фотографию. Дальше идем. Дальше показано, где вот и проводится в организациях, выезжают мобильные выездные бригады, и там на месте проводят прививки против коронавирусной инфекции. Угу. Дальше показываю. Следующий слайд, пожалуйста.
Да, переключила проблемы и причины недоохвата.
Ага. Вот смотрите, у нас, значит, в отношении сомнений в качестве эффективности вакцин, значит, есть и среди медицинских работников, и среди населения. В отношении эффективности вакцин люди болеют и вакцинированные люди особо не доверяют к этим вакцинам. Ну вот про эффективность и про качество вакцин. Второй – это учет регистрации, особенно среди мигрантов, потому что в городе Бишкек очень высокая внешняя такая внутренняя миграция населения. Дальше у нас идет механизм, именно вот такой слабый потенциал, механизм здравоохранения медработников, отслеживая и выявлению людей с упущенными возможностями. То есть, приверженность врачей тоже. Дальше у нас следующая, значит, проблема – низкий уровень осведомленности населения в вакцинации, ее преимуществах и безопасности вакцин. То, что люди все говорят, что за такой короткий период приготовления тоже вызывает такое сомнение, что считают они, что это бизнес. И говорят, что вот в связи с выходом первоначально, когда мы начали в прошлом году в это время с Синофаром, хотели, вот говорим, дала вакцину, поэтому говорили, что они хотят уничтожить. И то, что которые сейчас, вот сегодня коллеги из Грузии отметили, что у нас, у них это бесплодие вот именно приводит к получению этой вакцины, то же самое у нас вот такие, значит, сомнения, вот такие дезинформации в отношении вакцинации тоже были отмечены. А также вот широкая такая антипрививочная вот агитация с использованием информации интернет-сайтов и также самими медицинскими работниками. Интернет-сайты, еще и по WhatsApp-группе тоже несколько таких этих дезинформаций в отношении вакцин мы тоже получали. Следующий слайд. Значит, Ларис, пожалуйста, следующий слайд покажите.
Да, риски и
каковы
пути
риски,
решения.
да? Значит, отказ или неполучение проведения, значит, этих профилактических прививок против коронавирусной инфекции, она приведет к снижению или к отсутствию коллективного иммунитета, и это в свою очередь осложняет вот эпидемиологическую ситуацию на фоне трансграничной и внутренней миграции населения. Поэтому, значит, для того, чтобы решить эти вопросы, нам необходимо именно провести в первую очередь, улучшить вот качество и охват услуг на уровне ПНЦП, необходимо проведение и вовлечение всех медицинских работников, в том числе и среди стационаров, среди больниц, среди узких специалистов и среди населения. И ведь ситуация улучшилась, как таковой коронавирусной инфекции нет, и люди даже не хотят слушать о вакцинации, поэтому именно среди населения, среди медработников вот улучшение такой работы тоже необходимо. Дальше, значит, укрепить вот именно кадровый потенциал.
1 minute, please. Yeah.
Говорите, пожалуйста, Буру, у нас есть время, потому что
значит, необходимо... Ага, хорошо. Значит, необходимо укрепить кадровый потенциал, который проводивших вот именно вакцинацию населения и поддержку участковых медсестер, именно выявление вот невакцинированных лиц на обслуживаемом участке. И также необходимо, вот, чтобы использовать систему базы данных приписного населения и электронной системы регистрации вакцинации против COVID-19. Необходимо обеспечение вот каждого прививочного пункта ноутбуками или этими компьютерами. Также повысить необходимо уровень осведомленности населения о вакцинации с выездом по организациям, потому что выездная бригада и мобильная бригада у нас тоже работает. И увеличение количества мобильных бригад, которые, если необходимо в этих, для того, чтобы повысить охват населения именно среди труднодоступных населений города Бишкек и в том числе по республике тоже. Спасибо.
Oh, thank you, Burul, very much. I think this is extremely useful presentation and good identification of key areas. Obviously, there is a lot to be done, but we are not good with the timing. Do we have a team from Tajikistan to take over?
Здравствуйте, уважаемые коллеги и партнеры. Вы меня слышите?
Да, мы вас слышим очень хорошо.
Для начала хотел представиться, я Сайдуллов Файзали Баров, являюсь генеральным директором государственного учреждения Республиканский центр иммунопрофилактики, Министерства здравоохранения и социальной защиты населения Республики Таджикистан. И имею честь делать сегодня презентацию относительно преодоления решительности в отношении вакцины против COVID-19 в Таджикистане. Содержание моей презентации является данные о государственном учреждении Республиканского центра иммунопрофилактики, факторы, влияющие на недоверие к вакцинам против COVID-19, коммуникационные стратегии по изменению социального поведения, история успеха в борьбе с недоверием к вакцинации против COVID-19, а также необходимая помощь в реализации мероприятий в рамках коммуникации по изменению социального поведения. Относительно нашего центра хочу отметить, что государственное учреждение Республиканского центра иммунопрофилактики является одним из наиболее важных компонентов системы здравоохранения, целью которой является иммунизация населения в соответствии с их потребностями. Центр был создан в 1996 году приказом Министерства здравоохранения Республики Таджикистан. Она осуществляет реализацию национальной программы иммунопрофилактики через свою структуру, которая состоит из 6 филиалов в городе Шамбе, Сагдийской области, Бохтарской, Кулябской, Рашской зонах, Горно-Бадахшанской автономной области и 65 центров иммунопрофилактики в городах и районах республики. Республиканский центр иммунопрофилактики является единственным учреждением Министерства здравоохранения и социальной защиты населения Республики Таджикистан, обеспечивающий политику в сферу иммунопрофилактики в стране и несет ответственность за выполнение всех аспектов программы иммунопрофилактики. Вы видите в листок, что мы сейчас презентуем?
Мы видим сейчас первый ваш слайд.
Спасибо.
Попросите коллег, чтобы они двигали
Я
презентацию.
думаю, что все страны мира, которые осуществляют иммунизацию, четвертый слайд, против новой коронавирусной инфекции, сталкивались с факторами, которые влияли на недоверие населения к вакцинациям против COVID-19. Основными факторами, которые сталкивалась наша страна, это являлось. Первый – это недоверие некоторых слоев населения к качеству вакцин против COVID-19 в связи с тем, что инфекция является новой, а вакцины были разработаны в кратчайшие сроки. Также страх населения от поствакцинальных осложнений, особенно развитие тромбозов. Недоверие населения, второй, так вакцинации против COVID-19 на основе религиозных, как вы сказали, убеждений, сомнений в составе вакцин. Широкий доступ третьего населения к различным социальным сетям способствовал к убеждениям населения о том, что вакцина против COVID-19 имеет пагубное влияние на репродуктивную систему женщины, стать причиной это бесплодия, а также могут привести к летальному исходу. Пятый слайд. С целью изменения социального поведения страна начала использовать некоторые коммуникационные стратегии. Это разработка информационно-образовательных материалов, буклеты, баннеры, брошюры, ролики относительно важности иммунизации против COVID-19. Их широкое распространение среди населения на доступных для них языках. Организация открытых дискуссий с представителями джамаатов, религиозных лидеров и общественных деятелей с целью разъяснения их сомнений относительно безопасности вакцин против COVID-19 путем предоставления им научно обоснованной информации об эффективности вакцин. Центром религиоведов была издана фетва относительно приемлемости применения имеющихся в стране вакцин против COVID-19 среди мусульман. Выступления знатных профессоров и врачей по национальным телевизионным каналам и социальным сетям относительно качества и безопасности вакцин против COVID-19, а также важности своевременной вакцинации против данной инфекции для предотвращения тяжелых случаев заболевания и смертельных исходов. Шестой слайд. Относительно истории успеха в борьбе с недоверием к вакцинациям против COVID-19. Как было отмечено выше, в большинстве случаев недоверие у населения вызвало качество и безопасность новых вакцин, разработанных в кратчайшие сроки вакцин. Население считало, что за такой промежуток времени вакцина не может показать свою эффективность и лишь может только навредить. С целью рассеяния их сомнения и призыва к активному участию в вакцинации против COVID-19 Министерство здравоохранения и социальной защиты населения в первую очередь организовывало иммунизацию среди руководящих их министерства, в том числе министра здравоохранения, заместителей министра, руководителей правительства и прочих государственных учреждений. Далее иммунизация была организована среди глав представительства ВОЗ и ЮНИСЕФ в Таджикистане. Данные показатели мероприятий транслировались по всем национальным телевизионным каналам после чего люди начали активно и без страха проводить иммунизацию. 7 слайд. Для реализации мероприятий в рамках коммуникации по изменению социального поведения необходима помощь. Было бы хорошо первый раз разработать образовательные модули и проводить курс обучения для медицинских работников в офлайн и онлайн режиме по такими темами, как побочные проявления после иммунизации против COVID-19, это частые, редкие, долгосрочные. Вакцинация против COVID-19 и дети, вакцинация против COVID-19 и беременность, вакцинация против COVID-19 и гериатрия, вакцинация против COVID-19 и люди с аутоиммунными заболеваниями, с хроническими аутоиммунными заболеваниями. Также разработать и транслировать видеоролики по безопасности вакцин и их роль в снижении постковидных осложнений и смертности. И часто задаваемые вопросы относительно безопасности вакцин против COVID-19 и ответы на них со стороны знатных профессоров и врачей международного уровня. Еще хочу отметить, что с марта месяца 2021 года до марта 2022 года в страну всего поступило более 13 миллионов доз вакцин против COVID-19. За этот период в Таджикистане использовалось 5 видов вакцин. Это AstraZeneca, Coronavac, Moderna, Pfizer и Gamcovid-Vac. На состояние 29 марта 2022 года первой дозой вакцины против COVID-19 иммунизировано 92,4% в возрасте от 18 и выше. Второй дозы привиты 88%.
We have 1 more minute, please.
Целевой группы. Перевод. 10 января страна начала вакцинацию 3-й дозой вакцины против COVID-19, и на сегодняшний день процент охвата 3 дозами составляет 20,6% среди населения выше 18 лет. У меня все. Если у вас есть вопросы, буду рад на них ответить. Благодарю за внимание.
Thank you very much. Clearly, these are very clear points, and I hope we can help government on Tajikistan to move the coverage up. Now, I apologize to Virginia for my poor timekeeping, but Virginia, please go ahead.
Thank you, Drago. Thank you. That was very, very interesting to hear all of your different approaches, many similar issues with vaccine hesitancy in the different countries, but I thought there were some good innovative solutions. And it was also interesting to see areas where you could see that you would need support. I was taking notes on each of the country presentations, and some things jumped out at me, but I think what might be more interesting is if you were to pose questions in the chat box, or even just raise your hand using the little icon here where it says, I think we have a hand up here, or maybe Drago, you could coordinate that. But yeah, I think maybe if there's especially about the survey, because I thought it was interesting where you said that the majority of health workers in the region had a fairly high level of vaccine acceptance or low level of vaccine hesitancy. Did I hear it correctly, or was I?
No, I think
sure.
you have, yeah. I mean, most of them is vaccinated. But there is a good comment from Georgia coming about the education sector and how we poorly use that channel for communicating messages around COVID. Do you have any comments on that?
Let me see here. Actually, if you just open your microphone, feel free to please unmic yourself. So let's take that comment from Georgia. If you could just repeat.
Yes. I mean, one of the important concerns, and I have been listening to the other countries, and the country of Georgia is still a struggle. And we've been conducting the number of trainings and increasing the knowledge and awareness of healthcare workers, and we facing the fact that those short-term interventions are somehow not effective, and we have so many cases. I think I heard from in previous meeting with Azerbaijan, like having these false contraindications, and people even who are those who were going to the vaccination center and then returned back, and because of the not really direct, giving the negative recommendation, and we are losing those populations who somehow decided to get vaccinated. But now we're facing a big challenge, and I would have the question to my colleagues, if it's somehow declared already the pandemic is over in the country, and we all the restrictions we had, now we're how to say, abolishing those restrictions, and we see more and more attitude of among the public that it's kind of over, and we don't need anything extra to do. And so if there's something detecting the same situation in the country, what's the plan to how to communicate and proceed with vaccination?
Right. Yes, thank you, Marina. So I guess what you're saying is because, people are kind of jaded, they have pandemic fatigue. Omicron was declared not as severe. People are still getting it after being vaccinated, so that tends to decrease people's perceived risk, right? And they're feeling that they need to get a booster, for instance. So I'd be interested to hear if any of the countries have changed their messages in any way, or have they considered other strategies to reach those people who are becoming more resistant. Maybe they weren't before, but to get a booster, or they're from the extent of time the pandemic has been in existence, really. Anyone want to comment on that?
Yeah, we have the hand raised. Mr. Nabil, please.
Thank you.
Yes, thank you very much indeed once again. So I think most countries will be doing that, but I would like to point two quick things. The one is about the healthcare workers. Of course, the hesitancy, which is low or high, is a mere perception, is what the people feel and think. But having the people vaccinated could be done through the different other methods that would not take into account the hesitancy or not hesitancy. So that's a very important distinction that I would like to mention, particularly in regards to the healthcare workers or very elderly adults that to some degree could be pushed towards the vaccination. I mean, again, whether that's a good thing or bad thing, that's a different story. The second point that you mentioned about the changes of the messages or a communication strategy, given the current phase of the pandemic, I can say from Azerbaijani standpoint, it's still ongoing process. We're still accommodating the communication strategy and messages, because we're still with the news from China, with the news from the healthcare experts that this could be end, or this could be we could expect another new variant, and etc. We're still not sure what to do. Plus, the evidence is still being gathered about the regular vaccinations. What is the periodic need for the vaccination every 6 months, 9 months, and how long the protection will last. So I think in Azerbaijan, we're still looking for the evidence in order to form the strategy. But as I mentioned in the presentation, we're in the phase of maintenance in terms of the behavioral change part, and we're still promoting the booster dosing for those who haven't had that, and there are some people that haven't received one.
Great. Well, thank you. I think because we have very little time, I'm gonna try to. It's very hard because you all had so many great suggestions on different aspects. But a couple stood out to me. In addition to adapting your messages to the changing environment, using champions like the Minister of Health from Tajikistan mentioned, using religious leaders, influencers of the resistant groups or the priority groups in convincing them, and also remembering that or presenting or positioning the vaccine as a tool, not a be-all end-all, but something else. It's another tool, and it will decrease the severity of the disease rather than saying it's going to keep you out of the hospital, for instance. And then I think the infodemic issue is pretty universal, and really allocating resources to monitor the social listening, for instance, and monitoring those and using influencers in that space as well. And as far as the education that Marina mentioned, the lack of efficient ways of building capacity with health workers and information communication, who has courses on WhatsApp mobile health that may be helpful. They're updated fairly frequently with information. So, and like Giovanna said, they're developing bite-sized interactive courses as well. So, sorry to rush through the end there, but I think hopefully you're learning a lot from each other, and that's what this webinar is meant to do, is really to just share best practices, challenges, and how the project can help you work together on this issue. So thank you very much.
Thank you. I think for the sake of time, I would like to ask Brian, if he is still with us, to give us a few closing remarks. Unfortunately, we need to wrap up right now. Brian, are you there?
Yes, I'm here. Thank you, Drago. And it is my pleasure to make the closing remarks for the Regional Vaccine Hesitancy webinar series, which concludes today. To begin, I would like to especially thank the expert speakers and participants from ADB's member countries in the Central and West Asia region. I would like to thank you all for sharing your views, opinions, and experiences. It has made the discussion so enriching, and we have learned from each other. I have 3 points to make. The first, I would like to summarize a few of the highlights which country participants and experts have shared. On the factors related to vaccine hesitancy, the common ones were concerns about the quality and safety of vaccines. This is also affected by religious beliefs and decreased trust spilling over from overall pandemic response to COVID-19. Another is on the vaccine efficacy. Another is a perception on the low risk of infection and low personal responsibility. There's also the infodemic and misinformation and myths. And lastly, there's the extended target groups and vaccination requirements that are beyond traditional immunization programs, which the population has to really understand. On the second point, the most effective ways to address vaccine hesitancy, many speakers have highlighted about the continuous communication activities on increasing knowledge, confidence, and interpersonal communication skills of healthcare workers. Also, speakers discuss about mass media campaigns, including social media with clear messaging and information. Another aspect on addressing vaccine hesitancy is on involvement of grassroots and community level stakeholders, in some cases using champions and influencers. And lastly, on enforcement of policies and policies for employers, employees, and public spaces. In today's webinar, the vaccine survey results were shared for some 500 healthcare managers as of now, and I think this is continuing on in the next few days and will be wrapped up. And one or two results from that, which I found interesting, was that 1/3 of respondents think that vaccine communication campaign is successful. And a majority, around 88%, agree that the vaccine communication program needs some improvement in their country. And that a majority, around 76%, are confident in their and their colleagues' vaccination communication skills. The second point I would like to highlight is about the collaboration between the teams under two of ADB's technical assistance projects that work on COVID-19 vaccines and communications. And these teams comprising of the consortium of the Vaccine Advisory Firm, the Crown Agents, and Family Health International FHI 360, as well as the technical assistance on the Central Asia Regional Economic Cooperation countries and the Caucasus, CARIC and the Caucasus for short. And these two teams have worked over the past few months to support you on various aspects, such as vaccine planning and immunization, vaccine procurement, vaccine program delivery, vaccine development, and regional health security. And it is hoped that they will continue to be useful for you and your COVID-19 vaccination programs and coordinate with you on in the coming weeks. Third and last is to commend all the country participants on your achievements so far and to celebrate your incremental successes. You have all come a long way, where most countries have managed procurement and delivery of COVID-19 vaccines and administering these vaccines through national deployment and vaccination programs. But there still remains the common challenge of vaccine hesitancy. That is, there is a willing arm at the end of this chain. And I see that all of you are committed to the work ahead, and using these webinars and vaccine survey results as a catalyst, ADB and ADB's technical assistance projects will be in contact with you in the coming days to follow up on the next steps. Meanwhile, please do let us know where you think our support on vaccine hesitancy and communications may be needed in your COVID-19 vaccination programs. Thank you very much for your cooperation and support during this webinar series that concludes today. Before ending my closing remarks, I would like to convey a special thank you to the interpreters and the ADB staff behind the scenes for their contributions to make this a smooth event. And with this, I will call the webinar series on the vaccine hesitancy concluded. Thank you.
Thank you very much, Brian. Also apologize to all colleagues for making, particularly to Virginia, really apologize for that, for making this session shorter than it was supposed to be. But yeah, I think that the message was really clear, and we are looking forward to meet with the country colleagues as soon as possible and to work together. Thank you.
Thank you very much.
Спасибо большое, Лариса.